In the next couple of presentations, I'm particularly pleased to be able to present to you that we want now to look much more specifically at areas of concern. The first presentation will be addressing some specific areas of concern around Aboriginal and Torres Strait Islander people and methamphetamine. But then after that, we'll be moving on to look at the kind of interventions that we can run in the general practice and primary care settings and EDs. And then after that, we'll be moving on to Nicole Lee to talk more specifically about treatment. And that will be the segue into the workshops that are held after afternoon tea. So to keep us moving along on time, it's my great pleasure now to introduce you to our next speaker, who is Dina Saulo, and she's going to be talking about methamphetamine in Aboriginal communities and what we know and what the gaps are. So please welcome Dina.
Okay. Thank you. Okay, firstly, I'd just like to acknowledge the traditional owners of the land in which we're gathered on and pay my respects to the elders, both past and present. Today I'm going to be talking about the Goanna survey, which is the first national survey which looked at sexual health knowledge, access to services and risk behaviours among young Aboriginal and Torres Strait Islander people in Australia. I'd like to acknowledge the investigators also. This was a very large collaborative project. It involved the National Aboriginal Community Controlled Health Organisation and all of its national affiliates, so all the state and territory affiliates. And we received funding from the government from the ARC linkage. So why did we do Goanna? Because we know that there's an overrepresentation of young people in terms of STIs and bloodborne viruses, and we know that there's a lack of information available regarding young people around both STIs, bloodborne viruses, and their risk behaviours. So we endeavoured to do this through the Goanna survey, and we look to explore some of the behaviours and attitudes of young people. So this is a cross-sectional survey design, and we did recruitment through a number of different ways which are listed. And we did that through major cultural events in each state and territory. So affiliates identified cultural events in their area and did survey collection during those events. In New South Wales, in which I was involved in the survey collection, we did the Knockout, which is a large football event, and also Yarbin, which is a big survival day event on Australia Day. We had surveys which looked at demographic information, knowledge, STIs, around STIs and bloodborne viruses, and also risk behaviours and access to health services. We actually administered this through PDAs, and we found that this is a really good measure because it was anonymous and also very confidential. And by the number of people, young people that were recruited, you can see that it was quite a successful way of actually recruiting young people into studies. And it was largely run by the affiliates, as I mentioned. So over 3 years, in 2011, 12 and 13, each state and territory affiliate held 4 to 6 events, and there were 2,877 young people that were recruited into this survey. We had more females recruited. Anyone that's in a health service knows that we're getting more young Aboriginal women into services, and it was just reflected in our surveys too, even though we had young men also recruiting. We had more people in the younger age groups, 16 to 19, and we had a fairly representative sample across urban, regional and remote areas. So in terms of methamphetamine use by jurisdiction, it was 15% for ever using methamphetamine among any of the young people within the survey. But as you can see, in Northern Territory and Victoria, it was up to 21% of the sample from those areas. In terms of gender, 12% of females had ever used methamphetamines and 18% of males. And looking at the age groups, it was relatively similar across all the age groups. Around 14, 17 and 16% for those particular age groups. In terms of some of the demographic characteristics of young people who have ever used methamphetamine, we found that for women it was most, in our sample, it was more significant in the 20 to 24-year-olds, and for males in the 25 to 29-year-olds. And also, we had lower education too. So particularly for the males, we saw significantly less likely to have high school diplomas. And there's a little bit missing off the bottom there, but I think I can remember. Young people were actually more likely, who use methamphetamine, were actually more likely to be in touch with the justice system. So for females, it was around 4 times more likely to be in touch with the justice system, and it was around 3 times more likely for males. And I know we've talked a bit about polydrug use, but when we looked a little bit more in depth at methamphetamine use, 10% were only using methamphetamine, but you can see around 65% were actually using other drugs such as cannabis, ecstasy and cocaine. And alcohol use was very common amongst meth users, so around 80% of those participants that did have a history of methamphetamine use, also drinking more than 3 times a week. We know that there's lots of risk behaviours associated to alcohol and drug use, and among those that had a history of using methamphetamines, young Aboriginal people had earlier age of sexual debut. They were also more likely to have ever had oral sex, and also had a lower age of first oral sex. And we also know that young people that were using methamphetamine also had multiple partners, were more likely to have multiple partners. For health service access, we found that this is for females who had a checkup in the last 12 months, and this is for young females that have no history of meth use. And you can see that with the young women who did have a history of meth use, they were less likely to access health services. So green being the AMSs and the pink being GPs. But also we found that young people didn't know when they accessed health services, and we found also that they didn't know when they were getting STI tests. And I think that just reflects the fact that young people don't really care that much about their health, or they care about their health, but they're not accessing the services, or they're not youth friendly for them, or culturally appropriate. So in terms of males, you can see it was very similar for those, both male and females, that didn't have a history of methamphetamine use, and it was also similar for males and females that did have a history of methamphetamine use, so it was less access to those services. And it kind of reiterates the fact that we really need to resource AMSs to effectively address some of the issues for young people, and to be able to work with young people around drug and alcohol issues, but also make sure that our GPs are skilled up in handling those issues too. And this is just to reiterate the testing. So people were more likely to have a test, but they just didn't know when they had had the test. And they reported also, more people reported also never having a hepatitis C test also. So there are a few gaps around testing for young people. So the Goanna survey wasn't a representative sample nationally of young Aboriginal people. It was the first of its kind, and it was largely community driven, and it built capacity of Aboriginal workers on the ground. It built capacity of Aboriginal community controlled health services to run their own research or have those skills to be involved in research in their communities. And we know methamphetamine use is a significant problem for Aboriginal communities. We know that through surveys like this, but we also know that anecdotally from our workers in the community. And we found that the National Drug Strategy Household Survey reported 7% of Aboriginal people ever having methamphetamine use, and 2% within the last year, whereas in Goanna we found among young people it was 15% that had ever used and 9% within the last year. We know that the Aboriginal young people have multiple risk factors: polydrug use, higher STIs, bloodborne viruses. They've got the lower education overall, and a number of sexual health risk factors and being in touch with the justice system. So there's multiple issues and risk factors. And we know access to services is lower from the Goanna data, and it's lower compared to those that have not used. So, as I said before, we need to really resource Aboriginal medical services and the community controlled sector to actually address some of the issues in the community. We need more research and we need more data actually around use within communities, and we need to know if our GPs are actually equipped to deal with methamphetamine use among young people in our areas, and particularly cultural appropriate care for those Aboriginal and Torres Strait Islander young people. And we need a workforce that's confident to discuss risk behaviours and sexual reproductive health, because it goes hand in hand with any drug and alcohol use. And I think this is a major one for the young people, particularly within this survey. They had lower knowledge around STIs and bloodborne viruses, particularly compared to the school, the national school-based surveys. And we need to know where in our communities young people can access services that are going to meet their needs, because a lot of people didn't know where they could actually get help around alcohol issues, drug and alcohol. And I'd just like to acknowledge again the funders and also all the peak organisations and all of the affiliates who were involved in the data collection.